Hello everyone and welcome. I'm Vaibhav Thakur and I hold a B Pharma and M Pharma in pharmaceutics. Today I am excited to present to you a comprehensive overview. This is our starting point, so I'll keep it brief. In this session, we'll explore key aspects of pharmaceutical sciences, from fundamentals to advanced topics. Thank you for being here, and let's get started. Diabetes mellitus is a metabolic disorder, which means it affects how your body processes energy. It's characterized by problems with insulin, either because the body isn't producing enough or because the body's cells aren't responding to it properly. This leads to a condition called chronic hyperglycemia, where blood sugar levels stay elevated over time. There are two main types of diabetes we see most often. The first is type 1 diabetes, which is caused by an autoimmune process where the body's immune system mistakenly attacks the insulin-producing cells in the pancreas. This results in an absolute deficiency of insulin, meaning the body can't produce enough to meet its needs. Interestingly, this type accounts for less than 10% of cases. The second and more common type is type 2 diabetes. Here, the main issue is insulin resistance, where the body's cells don't respond properly to insulin. Over time, this can lead to a relative insulin deficiency because the pancreas can't keep up with the increased demand. This type makes up over 90% of cases and is often linked to factors like obesity and lifestyle choices. Understanding these differences is crucial because it influences how we approach prevention, management, and treatment of diabetes. This overview ties into the broader theme of how metabolic health impacts overall well-being, and recognizing these key distinctions helps us develop better strategies to combat this widespread condition. Today, let's delve into the etiology, or the causes, behind this condition. Understanding the root causes is essential because it helps us grasp how and why the condition develops. Causes can be quite varied, ranging from genetic factors to environmental influences. For example, some conditions are inherited, meaning they run in families due to specific gene mutations. Others might result from lifestyle choices or external factors, such as exposure to certain chemicals or infections. Recognizing these key points allows us to see the bigger picture, how different elements contribute to the onset and progression of the disease. This understanding not only informs diagnosis, but also guides us toward effective prevention and treatment strategies. So, as we move forward, keep in mind that the etiology is the foundation for everything else we'll discuss in this presentation. Let's talk about the early symptoms of hyperglycemia. One of the first signs you might notice is polydipsia, which is increased thirst. When blood sugar levels are high, your body tries to dilute the excess glucose by making you drink more. Along with that, polyuria, or frequent urination, becomes common because your kidneys work overtime to eliminate the excess sugar. You might also experience polyphagia, meaning increased hunger. Despite eating more, some people start losing weight, especially in type 1 diabetes, because the body can't properly use the glucose for energy. Blurred vision is another symptom that can occur as high blood sugar affects the lens of the eye, impacting your ability to see clearly. Many individuals also feel fatigued and dehydrated, which can make everyday activities more difficult. Now, if hyperglycemia goes untreated, it can lead to more serious, later complications. These include vascular disease, which affects blood vessels, neuropathy or nerve damage, nephropathy or kidney damage, increased risk of infections, and heart disease. The latter is actually a major cause of mortality in people with uncontrolled diabetes. Understanding these symptoms and signs is crucial because early detection and management can prevent many of these severe complications and help maintain quality of life. Let's take a closer look at how we diagnose diabetes through plasma glucose measurements and HbA1c levels. When it comes to fasting plasma glucose, a level of 126 mg/dl or higher is a key indicator. This means that after an overnight fast, if your blood sugar is at or above this level, it suggests diabetes. Similarly, the 2-hour oral glucose tolerance test, or OGTT, with a reading of 200 mg/dl or more, is also significant. This test measures how well your body handles glucose after consuming a sugary drink. Additionally, if you have a random plasma glucose over 200 mg/dl and are experiencing symptoms like increased thirst, urination, or weight loss, that can point toward diabetes as well. Now, moving on to HbA1c, which gives us a picture of your average blood sugar over a few months. An HbA1c of 6.5% or higher confirms a diagnosis of diabetes. On the other hand, a level between 5.7% and 6.4% indicates prediabetes, meaning there's an increased risk of developing diabetes if no lifestyle changes are made. It's important to note that diagnosis generally requires confirmation through repeat testing, unless there are clear symptoms and very high glucose levels that make the diagnosis obvious. Understanding these criteria helps us identify and manage diabetes early, which is crucial for preventing complications and promoting overall health. When it comes to treatment, the key point to remember is that type 1 diabetes requires lifelong insulin therapy, which can be delivered through basal bolus regimens or insulin pumps. This continuous insulin replacement is essential for managing blood sugar levels effectively over the long term. For type 2 diabetes, however, the approach often begins with lifestyle modifications. This includes changes in diet, increasing physical activity, and aiming for weight loss, which can significantly improve blood glucose control. If lifestyle changes alone aren't enough, medications are added into the mix. The first-line medication for type 2 diabetes is usually metformin, which is well established and effective. As the disease progresses, or if additional control is needed, other agents like GLP-1 receptor agonists, SGLT2 inhibitors, or even insulin may be introduced, especially in more advanced cases. Finally, an important part of managing diabetes involves preventing complications. This can be achieved by controlling blood pressure using ACE inhibitors or ARBs, prescribing statins to manage cholesterol levels, and ensuring patients are up to date with vaccinations. All these steps are crucial in reducing the risk of cardiovascular and other diabetes-related complications, supporting overall health and well-being. Let's talk about monitoring blood glucose levels regularly. This can be done through simple fingerstick tests or with continuous glucose monitors, or CGMs, which provide real-time data throughout the day. Regular monitoring helps us understand how well blood sugar is controlled and allows for timely adjustments to treatment. Next, we have the importance of checking HbA1c every 3 to 6 months. This test gives us a long-term view of blood glucose control, and the goal is generally to keep this value below 7%. Maintaining good control reduces the risk of complications down the line. Now, when it comes to screening for complications, timing is key. For type 1 diabetes, it's recommended to start screening 5 years after diagnosis. For type 2, screening begins right at diagnosis. These screenings include annual foot exams to check for neuropathy or ulcers, fundoscopy to look for diabetic retinopathy, urine tests for albumin to assess kidney health, and evaluations of kidney function and lipid profiles. Finally, we need to keep a close eye on cardiovascular health. This involves monitoring with ECGs to detect any heart issues early, as well as regular lipid measurements. Overall, consistent monitoring is crucial for managing diabetes effectively and preventing serious complications. Now, let's talk about complications. When dealing with this topic, it's important to recognize that there are often challenges that can arise. These complications can vary widely, from technical issues to unforeseen obstacles in implementation. Understanding these potential problems helps us prepare better strategies to address them effectively. For instance, some complications might involve resource limitations or unexpected patient responses, which can slow down progress or require adjustments. Highlighting these points reminds us that, while the overall goal is clear, the path to achieving it isn't always straightforward. By anticipating possible complications, we can stay flexible and proactive, ensuring that we stay on track and continue moving forward towards our objectives. Let's take a closer look at how lifestyle and education influence this topic. First, our lifestyle choices, such as diet, exercise, and daily habits, play a crucial role in shaping our overall health and well-being. These habits can either support or hinder our efforts toward a healthier life. Education, on the other hand, provides the foundation of knowledge that guides our decisions. When we're well-informed, we're more equipped to make choices that align with our health goals. It also helps us understand the importance of prevention and early intervention. Connecting these points to the overall theme, it's clear that both lifestyle and education are essential components. They work together to empower us to take control of our health and make sustainable changes. Ultimately, fostering good habits and continuous learning can lead to better outcomes and a more balanced, fulfilling life. Let's take a closer look at special interventions. These are targeted strategies designed to support individuals with specific needs. They go beyond general approaches and are tailored to address particular challenges effectively. For example, some interventions might include behavioral therapy, academic accommodations, or social skills training. The key point is that these interventions are personalized and data-driven, ensuring we meet each person's unique requirements. Connecting this to the overall theme, it highlights how customization and early support are crucial in fostering better outcomes. By implementing these specialized strategies, we can make a meaningful difference in individuals' lives and promote more inclusive environments. Thank you so much for your attention. I really appreciate you taking the time to go through this presentation with me. I hope the key points we've discussed today have provided you with valuable insights and a clear understanding of the topic. Remember, the main ideas are about the importance of innovation, collaboration, and continuous improvement in achieving success. These concepts tie back to the overall theme of growth and adaptability in a changing world. If you have any questions or want to explore any of these ideas further, please feel free to reach out. Once again, thank you for your time and engagement.